Well, this month is Alzheimer's Awareness Month. So coming up, we're learning about symptoms and a new study hoping to find a better way to make a diagnosis. Welcome back. It is 8:52 now on your Saturday morning. This month is Alzheimer's Awareness Month. This is the 6th leading cause of death, and it can be very difficult to diagnose. Here with more information about the disease is Dr. Eric Beltz from Northwest Radiology. You're a neuro-radiologist. Can you talk about the prevalence of this locally or nationwide? But how often does this affect families?
Well, Alzheimer's disease is the most common dementia over the age of 60. It's the cause of 1 in 6 deaths in America. The study that we're here to talk about today is the IDEAS study.
This is something new.
Correct.
Okay.
It's a study sponsored by the American College of Radiology, Alzheimer's Association, and CMS to diagnose, help develop a more targeted diagnosis of dementia and hopefully catch it earlier so that you can get better patient outcomes.
And catching it earlier, I think families, that's kind of music to their ear, something they want to hear that could maybe prolong life, quality of life especially. Can you kind of talk about the overall hopes for this?
Sure. So dementia diagnosis is difficult. There is overlap signs and symptoms with other dementias. About 10 to 20% of the patients that are diagnosed with Alzheimer's disease clinically will not have Alzheimer's disease at autopsy. So what this imaging does, it actually allows us to visualize the amyloid in the brain. And that amyloid is what is known to be in what's called a neuritic plaque. And that density of neuritic plaque is how we can diagnose Alzheimer's disease. While the scan isn't 100% for Alzheimer's disease, most patients that test positive with it will have Alzheimer's disease, but there are other dementias that can be positive with it as well. But actually, one of the greatest benefits is when it's negative, because when the scan is negative, there's about a 96% chance the patient does not have Alzheimer's disease.
And as someone, so you're the person who reads these tests?
Correct.
Is this a game changer? Could this be a game changer for these families who are going through this?
Well, hopefully the diagnosis will result in more clinical accuracy and then lead to better treatments for the patient.
So the more you know, the better in the long run it could be. Talk to me about what family members should maybe look out for, or some things maybe they don't want to avoid. Don't wait to go talk to a doctor.
Correct.
What would you tell family members?
Some of the signs are non-specific for cognitive disorders, memory problems, getting lost. So I'd recommend that if patients are concerned that they may have a cognitive disorder, that they should seek a neurologist, a psychiatrist, or a geriatrician. And if they're interested in the IDEAS study, then they go to ideas-study.org to find out more information.
Great. Well, thank you so much for coming in. I know this is information that a lot of families would be very interested in. This is something that can change the dynamic of a family, so thank you so much. As he said, the website is ideas-study.org, or another website, if you just want to get more information, is northwestradiology.com. Dr. Beltz, thank you so much for coming in this morning.